Hematology for nursing students. Understanding lab values and assessments. As a nurse, it's essential to understand the hematological system and its various components. In this video, we will discuss the normal lab values for hematology tests, indications for hematological lab tests, and the components of hematological system assessment. Lab values. Let's start with normal lab values for hematology tests. These tests help to determine the number and quality of blood cells and the presence of various diseases. The normal range of hemoglobin levels in adults is between 12 to 18 grams per deciliter. Specifically, 12 to 16 grams per deciliter for females, and 14 to 18 for males. The normal range of hematocrit levels is between 37% to 54%. That is 37% to 47% for females and 42% to 52% for males. White blood cells are measured in the number of cells per cubic millimeter. The normal range is between 5,000 to 10,000 per cubic millimeter. Platelets are also measured in the number of cells per cubic millimeter, with the normal range being between 150,000 to 450,000 per cubic millimeter. It's essential to understand these values to interpret lab results accurately. Any significant deviation from these values can indicate the presence of a disease or disorder. Indications for hematological lab tests. Now let's talk about the indications for hematological lab tests. These tests help to diagnose and monitor various conditions, including anemia, leukemia, infections, and bleeding disorders. When assessing the hematological system, there are several components to consider, including red blood cells, white blood cells, and platelets. Red blood cells carry oxygen to different parts of the body. White blood cells fight infections, and platelets help to clot the blood. Hematological assessment. A comprehensive hematological assessment includes a physical exam, blood tests, bone marrow biopsy, and imaging tests. During the physical exam, the nurse may check for signs of anemia, such as pale skin, fatigue, and shortness of breath. They may also look for signs of infection, such as fever and swollen lymph nodes. Blood tests can help to determine the number and quality of blood cells, while bone marrow biopsy can help to diagnose various disorders, including leukemia. Imaging tests, such as X-rays and CT scans, can help to identify abnormalities in the blood vessels and organs. Now, let's discuss some commonly used terms and definitions as well as what they represent in the blood and common tests performed on coagulation. Neutrophils, eosinophils, basophils, lymphocytes, and monocytes are all different types of white blood cells, each with unique functions in the immune system. Understanding the role of these cells and how they respond to different types of infections or foreign particles can aid in diagnosing and treating various diseases. Neutrophils are the most common type of white blood cell and are primarily responsible for fighting bacterial infections. When bacteria invade the body, neutrophils are quickly recruited to the site of infection, where they release enzymes and chemicals that help destroy the bacteria. Eosinophils are another type of white blood cell that are primarily involved in fighting parasitic infections. When the body detects the presence of parasites, eosinophils are activated and recruited to the site of infection. Eosinophils release chemicals that help destroy the parasites and also play a role in controlling inflammation. Basophils are a type of white blood cell that plays a role in allergic reactions. When the body encounters an allergen, such as pollen or pet dander, basophils are activated and release chemicals, such as histamine, that cause the symptoms of an allergic reaction, such as itching, swelling, and inflammation. Lymphocytes are a type of white blood cell that plays a crucial role in the body's immune system, specifically in fighting viral infections. There are two main types of lymphocytes: B cells and T cells. These cells produce antibodies that can recognize and neutralize specific pathogens, while T cells can directly attack infected cells. Monocytes are a type of white blood cell that can differentiate into macrophages, which are cells that can engulf and digest large foreign particles, such as bacteria or dead cells. Abnormalities in cell counts. Leukocytosis is a condition where there is an abnormally high number of white blood cells in the blood, which can be indicative of an infection or inflammation. Leukopenia, on the other hand, is a condition where there is a lower than normal number of white blood cells in the blood, which can increase the risk of infections. Thrombocytosis is a condition where there is an abnormally high number of platelets in the blood, which can increase the risk of blood clots. Thrombocytopenia is a condition where there is a lower than normal number of platelets in the blood, which can increase the risk of bleeding. Pancytopenia is a condition where there is a lower than normal number of all types of blood cells in the blood. Tests for coagulation. A PTT and INR are laboratory tests used to monitor the blood's ability to clot. A PTT stands for activated partial thromboplastin time, which measures the time it takes for the blood to clot after a substance is added that triggers clotting. When R stands for international normalized ratio, which measures the blood's ability to clot in response to medication, such as warfarin. These tests are commonly used to monitor patients who are taking blood thinners or to diagnose clotting disorders. In conclusion, understanding the key terms and concepts related to hematology is essential for nursing students. Being able to recognize and interpret laboratory values, as well as understanding the indications for hematological lab tests and components of the hematological system assessment, can help nursing students in the diagnosis and treatment of various diseases. Moreover, having a good grasp of the different types of white blood cells and their functions can aid in the identification and management of various infections and allergic reactions. Ultimately, the knowledge gained through learning these concepts can contribute to the overall success of nursing students in their practice and the improvement of patient outcomes.